So what you will find here at Real is that we can provide all the different types of anaesthesia that you can have otherwise in other hospitals, including the NHS. We have firstly local anaesthesia, secondly regional anaesthesia, thirdly sedation, and very lastly general anaesthesia. So if we start off with local anaesthesia then, local anaesthesia is where we inject some local anaesthetic in a small area of your body, thereby numbing it up. What local anaesthetic does, and that's what we inject, is that it tells your nerves to go to sleep. And in doing so, it takes away the sensation of pain and being able to feel what's going on. If you were to have local anaesthetic, then you'll be awake for the procedure itself. Secondly, we have regional anaesthesia. So with regional anaesthesia, once again, we are injecting local anaesthetic, that numbing agent that sends nerves to sleep, but we're injecting it in order to block a larger part of your body or a deeper part of your body. When we do use regional anaesthesia, what we can do is either we can have regional anaesthesia by itself, in which case you'll be awake, or we can combine it with either sedation or general anaesthesia. Thirdly, we come on to sedation. So with sedation, what we're doing is we're giving you a sedative drug into your bloodstream in order to make you feel comfortable, relaxed, and less anxious. What you'll find we can do with sedation is there's different levels of it. There's mild sedation, what we call conscious sedation, and deep sedation. And we can individualize that depth of sedation to what you need as a person and what you need for the procedure or operation in hand. So we can very much tailor it to your requirements. The great thing about sedation is that the side effects are less compared to general anesthesia, and the recovery is much faster. So there are some pros to sedation, but not everything we do can be done under sedation itself. So lastly, we come to general anesthesia. With general anesthesia, that is where we have what we call controlled unconsciousness. You are completely asleep for the operation itself. What's really important for you to know about the type of general anesthesia we provide here at Real is that it is total intravenous anesthesia. What that means is that all the anesthetic goes through the veins. There is no gas. The reason why that's so significant is at least fourfold. Firstly, it is associated with much improved surgical operating conditions. And that's important to you, and that's important to the surgeon. Secondly, it has a reduced risk of post-operative nausea and vomiting. Thirdly, it tends to result in much more rapid recovery times for you as a patient. Lastly, total intravenous anesthesia is beneficial to the environment, particularly as gases are so bad for it.